Good afternoon and welcome to Clinical Pearls. I'm your host for today, Dr. Allison Jones. Make sure you subscribe to our network, and if you would like to join the conversation today, type your comments or your questions into the chat box and we will get to as many of them as possible during the conversation. Today we're going to talk about care for military veterans, both active and veterans.
Hi, come on, puppy, thank you.
To introduce Dr. Pat Peterson, and I'd like to give you
What's in there?
a background
What
on
do
you,
you
Dr.
see?
Peterson.
Hi, my name is Pat Patrician. Excuse me, I'm a professor and the Rachel Booth Endowed Chair in Nursing at the University of Alabama at Birmingham. And I also co-direct the VA Quality Scholars Fellowship Program, and I'm a 26-year veteran of the Army Nurse Corps.
Thank you, Dr. Petrician. And our other guest today is the Honorable Dr. Linda Schwartz. Dr. Schwartz, could you introduce yourself, please?
My name is Linda Schwartz, and I am medically retired from the Air Force. I was in an aircraft accident when I was serving as a flight nurse. I'm now a special advisor to Vietnam Veterans of America, as well as being on the faculty at Yale School of Nursing. I've had the pleasure to be the Commissioner of Veterans Affairs in the state of Connecticut for 11 years, and I had the honor to be President Obama's Assistant Secretary of Veterans Affairs for Policy and Planning.
Thank you both for joining us today, and I want to take a moment and thank you both for your service as well. I'd like to talk a bit about how you got into military nursing. So, Dr. Petrician, what spurred you to join the military as a nurse?
Well, actually, I thought of the military while I was in nursing school because I was sort of dissatisfied with the way I saw healthcare practiced in our local community hospitals. And so in the library, I found some works by military nurses, and they talked about the professionalism of nursing in the military, and that really drew me to the military service. So I contacted a recruiter, and the recruiter took me on a tour of Walter Reed and a couple other places, and I had no doubt in my mind that that's what I wanted to do, at least for 3 years, and then the rest is history.
And Dr. Schwartz, how did you end up joining the military and becoming a military nurse?
Well, my family all had served in the military, and I was growing up at the time of the Vietnam War, and I had chosen nursing as my profession. And as I continued in my studies, more and more of the Vietnam War kept coming into our living rooms up close and personal every night. And I think it was out of a sense of duty that I had a skill that was needed and that I really wanted to help. So, in the interim, I read about flight nurses. These are nurses who actually care for patients in transit on aircraft and mostly casualties. So, I really wanted to join. I really wanted to join the Air Force. My father really wanted me to join the Navy, but I won.
So I wonder, Dr. Petrician, can you clarify some terms for us? What is the difference between active military versus reserve and then veterans?
Okay, first of all, I want to clarify the terms military and veterans. And I want everyone out there to know that the Department of Veterans Affairs and Veterans Healthcare Administration is very separate from the military health system. Department of Defense and Department of Veterans Affairs are two different departments, and they're funded differently. They take care of different patients. When you're active duty military and you're serving, 24/7, you get all of your health care in the military healthcare system. The military is moving towards a combined system called the Defense Health Agency, but the military will still maintain their Army Medical Department, Air Force Medical Department, and Navy Medical Department, which also takes care of Marines. So if you're on active duty, that's where you get your health care. When you're retired from active duty or you decided to come off of active duty, and you have veteran benefits that you're eligible for, then you're eligible for care in the VA healthcare system. If you're serving as a reserve service member, that means you are serving 1 weekend a month and 2 weeks a year generally. When you're actually serving in that capacity, you are considered on active duty. So you can get your health care at an active duty base or that has a healthcare system, or you can get your care in the civilian sector, because many reservists have their own health insurance because the reserve is sort of their second job. It's something that's not their primary source of employment. So there's huge differences between the Department of Defense and the Department of Veterans Affairs, and a lot of people don't realize that. So that's something I want everyone to know.
Yeah, I agree. And I think that's something that a lot of people aren't aware of, which is beneficial to the bedside nurse. Dr. Schwartz, what are some major health issues that face this population? We're constantly hearing about mental health problems and PTSD, but what other conditions might these active military or veteran patients face?
I think that the data shows us that musculoskeletal uh, just musculoskeletal problems, because of the nature of the training and the work, that is like the number one thing. But for those who have been deployed or have seen combat, and even for some, we're finding that even doing the training is sometimes very traumatic for them. And so post-traumatic stress disorder, not disorder anymore, but post-traumatic stress is one of the actually one of the sentinel things that is associated with military service, both because of the nature of the war and nature of making war, and also um, some of the situations people encounter. So military sexual trauma is another thing. It's not, it is being talked about more now than ever before, but it is something that is part of the territory and needs to be addressed. The other things that seem to happen, people who stay in the military for a long time, even to retirement, often have a lot of chronic diseases that maybe have been managed well while they were on active duty or in the military, but still needs the kind of constant care and help. So that's mostly some of the important things. Right now, though, toxic substances, burn pits, especially for our generation, they're in the field now, and Agent Orange, and even before that, um, some of the research that was done, or some of the programs that were designed to test new drugs on military members. These are an important part of what needs to be addressed more fully. After 50 years after the Vietnam War, we're still fighting for Agent Orange. In fact, just this last month, the several diseases were finally acknowledged as being associated with exposure to Agent Orange. The idea of many of the substances or situations you might encounter today, there is very little known about all of the hazards. So the constant being in touch with caregivers and caregivers being in touch with their patients as far as any exposures that they may have encountered or places they had served are important for clinicians to know.
So, Dr. Patrician, I'd like to go back to you for a moment. And you mentioned that veterans are eligible to receive care through the Veterans Administration. Is that not something that they are automatically enrolled in?
No, once you leave active duty, or right before you leave active duty, the military, usually in your out briefing retirement processing, someone helps you go through your records, your health records, and they determine what percent of VA disability you could qualify for. And the VA it does not provide health care. The VHA, Veterans Health Administration, does not provide health care for all military retirees or all military veterans. If you've been wounded in a war or on active duty and your VA disability is high, like 75%, 100%, then you would qualify for Veterans Health Administration benefits. If you only have a small percent of disability, which many of us do have when we leave the military, if you've served 30 years, you might have developed asthma while you were on active duty. Maybe you would have developed it, if you didn't go on active duty, but we say that's service connected. So before you retire, you really need to have someone help you go through your records and see if you qualify for VA benefits. The problem is that many people who are now very sick, people who have been exposed, like Linda said, to some of these toxic substances, to Agent Orange, might now be at a higher disability rating. So this brings us to something I want Linda to talk more about, and that's the Have You Ever Served campaign. This is something that Linda started, and thank God she did, to help civilian healthcare providers identify veterans and connect them to the VA system so that we can see if they are eligible for VA benefits and what VA benefits they would be eligible for. So could I just turn it over to Linda to tell us how many people that are military retirees and military service members who are off of active duty who might qualify for VA benefits, and how many actually do receive their care at the VA?
Well, the nature of the VA healthcare is that Congress and even state governments change the eligibility for some of these services. But basically, a lot of people don't think when they leave the military, they think they don't think there's anything wrong with them, and they just keep on going. But we find that, like Agent Orange and burn pits, new information comes through every year, every month, and so people don't really actually know. I could share a story that about Have You Ever Served, which actually helped to stimulate the effort. We had a Vietnam veteran had collapsed in a home in Connecticut. I was Commissioner of Veterans Affairs in Connecticut, so all things veteran. They called me and said, "This guy just passed out. They're transporting him to a local hospital. We don't know anything about him." Got a call from his wife. He had served in Vietnam. So all we knew is he had served in Vietnam. He was in ICU. People did not know anything about him, or he didn't know. And we finally, we had a listing of the diseases that are associated with exposure to Agent Orange. one of my service officers took it to the hospital and gave it to the doctor and said, "Do you think he has any one of these?" And the doctor looked at it, and lo and behold, the man had Hodgkin's, and he didn't even know it. He had been sick for years. He didn't know that he could get free care and assistance from the VA. He was he had been sick for a long periods of time, but never thought that VA could do anything for him. Another thing is the association of exposures on the children and the families. Unbeknownst to many people, Camp Lejeune, the water was contaminated there for almost 20 years, from 30 years, 1957 to 1987. When we were creating this card, my secretary came in. She said, "Is this true? This about Camp Lejeune?" She had been born there. She lived there, and her father was stationed there. She had no idea that she may have been exposed to toxic and contaminated water. So that's why we thought, especially now with the major people, the garden reserves, as was mentioned before, some of them want to go back to their own providers that they had. They're not in the military system, but oftentimes some of these have exposures do have um, implications for health conditions and that need to be monitored. For example, for many years, people didn't know that Agent Orange is also associated with type 2 diabetes. So you think if we had acknowledged this early on, many people might have been spared the surprise and also the disease and debilitating conditions that are associated with type 2 diabetes. So we wanted to be sure that we were doing the best. This started out in Connecticut, but it certainly caught on. Both from Vietnam Veterans of America kind of adopted it and shepherded it around. And then we were able to get the American Academy of Nursing to really take this on as a way of assisting uh, clinicians and veterans and their families. So the card itself is very different than some cards because we just don't name the exposure. We talk about conditions that are associated with that exposure. So clinicians might have some questions about concussions or brain injuries. Discussions in this little pocket card are right there for their referral. Also, suicide is a very big concern, especially in the veteran population. And in this card, although we don't ask the clinician to ask the client, the person, about these, we call their attention to the fact that this is an important issue, and kind of remind them to be alert to some of the symptoms that may be of suicidal risk that might be demonstrated by the patient before them.
Dr. Patrician, can you speak a little bit about what is going to be important for the bedside nurse to know in caring for active military or veteran patients?
I would say for the bedside nurse, if you're taking care of an active duty person, and you might be, we don't have military hospitals at every single location around the country, not even at every base. And with the changes in the way military healthcare is consolidating, we'll probably have fewer and fewer military hospitals. So if someone is injured, for example, at Redstone Arsenal, and they're active duty, they would probably go to Nashville, to Vanderbilt, or to UAB. And so what you need to know is that they are active duty, that there will be probably their chain of command will want to know information about them or will want to visit. I know with COVID that's a little different right now, but generally speaking, especially if you were enlisted and if you're a young enlisted soldier or airman or other service member, your commander is like your mom and dad. Your commander needs to know conditions about you. Your commander needs to visit you while you're in the hospital. So I would say that the service members' chain of command is very important. So don't discount them. And I know everyone needs to follow HIPAA rules and regulations, and you probably need to ask the service member if it's okay to talk with their commander, but generally they would say yes. Another thing I would say is if you know anyone who might be a veteran, well, number one, you should always ask on your history and physical when someone's admitted, have you ever served in the military? And then if they do have chronic illnesses and there's some of the conditions that Linda had talked about, then I would strongly refer them to the VA to see if they're eligible for VA benefits. There's other benefits even besides healthcare that veterans can get. And I think, here's the website on how to apply for VA healthcare, how to find out if you qualify. If you're an older veteran, World War II, Vietnam, Korean War, and you have a variety of chronic illnesses, some of them might have been caused by your service might have contributed to them. Why pay for health care when you can get your care at the VA? And the VA does have excellent care, but despite what you see in the news. Because the VA is federally funded, and so is the military. When anything bad happens in the VA or the military, you certainly hear about it in the news. But I need to tell you that the VA is probably miles ahead of everyone else on their quality improvement and their high quality care. So ask the question. Ask, have you ever been in the military? And please go to the American Academy website, American Academy of Nursing, or the Have You Ever Served website, haveyoueverserved.com, and download some of those cards and pass them out to your fellow colleagues, your nurses and physicians who you work with. I guess I'll stop there, but Allison, if you want to talk about the I Serve Too campaign, we can do that too.
I think that would be great because I, for one, did not know that existed. So can you or Dr. Schwartz, would you like to share with us?
Oh, I think I Serve Too is Dr. Patrician's forte. I did want to say something else. That for clinicians, there are other benefits. Last night I was watching the news, and it talked about a young veteran who was destitute. In reality, VA has what they call a wartime pension. So if people serve during a wartime, the VA is authorized to provide some subsistence for them. It's not a great amount of money, but as I like to point out to some of our homeless veterans, it's something rather than nothing. And another thing, for example, I was a public health nurse, and one day we were wrestling with a problem. One of our coworkers' sister was going to be committed to the state hospital, and they were like frantic not to have that happen. And I just said, "Well, did she ever serve in the military?" And they go, "Yes, they did." So we could get her into the VA hospital, and she didn't have to go into the state hospital. But in addition to that, there are home loans and all these other things. But I did want to say that the concept of knowing who you're talking to. First of all, asking if somebody served in the military, it's kind of an icebreaker if you do have a veteran there. But I know my sister was being admitted to Cleveland Clinic, and they asked her if she was a veteran, and she said, "I'm not, but I know why you're asking that question." So it's also to raise the awareness of the clinical people, not only to the veteran themselves, but there are other. I wanted to mention that some of the children of Vietnam veterans have spina bifida. some of the children of the people who were serving at Camp Lejeune, all of them are getting into some sort of support and assistance for the conditions associated with these exposures.
And Dr. Patrician, I believe that connects to the I Serve 2 campaign.
Yes, the
right?
I Serve 2 campaign was created, it was sort of a spin-off of the Have You Ever Served campaign. And the brainchild of this is Dr. Alicia Rossiter. And I believe on the card there is an article that we had, that I co-authored with Alicia in Nursing Outlook about the I Serve 2 campaign. Military children, especially those of reservists, whose parents might have been away deployed in the current wars that we've had, they don't have the services necessarily that you'll find for the active duty children. The children of active duty members are usually living on post or close to a military installation where there are a variety of services for children, because the military is big on families and children. But the reservists were sort of left behind. And so Alicia, being a nurse practitioner, noticed that there's a lot of military children of military reservists who are having some issues and difficulties with the long-term and numerous deployments of their parents. So we created the I Serve 2 campaign to recognize that children of active and reserve service members are also having some issues, behavioral issues in school and other things. So if you're working in a pediatric facility, it's a good idea to ask the parents, have the parents served in the military, or ask the child or sibling, have your parents served in the military? Because there's some connectivity with some of the active duty resources for these children.
Those are excellent resources, and thank you for sharing that. We do have a question from the audience. They would like to know if you could talk a little bit about what it's like to have a career in military nursing. Dr. Schwartz, would you like to go first?
Well, I loved my military service. I would have stayed in, except I was in an aircraft accident. It is very challenging, but also at the same time, very rewarding in many respects, because you do get the opportunities for, I want to say adventure, but it's challenging, so that you can, actually, I never thought that I would be a flight nurse, although I wanted to be, but that is a kind of when you're at altitude flying over the Atlantic Ocean and someone decides to start bleeding, and you're the only medical personnel on the flight, that's a challenge. But it's also very rewarding that you can handle these situations, especially the nurses today. They have my greatest respect because of the kinds of injuries that we are seeing. So I would say, if you want adventure and you want to be challenged and you want to be supported in your quest for excellence in nursing, military nursing is a good place to go.
Thank you. And Dr. Patrician, can you talk a little bit about your career in nursing?
I came in the military for the professionalism. And I thought, well, I could do anything for 3 years. That was my service obligation. I ended up staying 26 years. And the reason is, and besides, I was a single parent when I came in. They were just a few years before that allowing single moms, and I don't know about dads, but single moms to come into the Army Nurse Corps. And I was happy with that. What I found in the military is the professionalism that I was seeking. There's a certain, I guess the practice environment that's created in the military is something that is very similar to what you find in magnet hospitals. And some of my research is panning that out. I mean, we're finding that some of the subscales of the instrument we use are very similar between magnet and military hospitals. But you get the opportunity to advance in your leadership skills. You're a staff nurse for just a few years, maybe 5 at the most. You're encouraged to seek out a specialty. Mine was critical care. I went to a course and had clinical and didactic that prepared me to work in any critical care environment. So I worked in critical care for a while. I got my master's degree partly part-time on my own, and I applied to go full-time with the military. I got my master's degree paid for. And then I had a nurse manager job for a while. I got into some educational programs. I ran the continuing education program for the Army Nurse Corps for a little while and all of their professional courses. And then I wanted to go to school and get my PhD. That was always on my to-do list, to get a PhD. And the military pays for that. If you qualify to get their long-term health education and training program, they'll pay your salary and pay your tuition. No, I don't know anybody else that does that. So the military is really big on advancing you as a nurse. They're really big on supporting nursing research. The first research service was in the military in Walter Reed in like 1952. Now there's nursing research services in most major academic medical centers. But that was started in the Army. There were so many things that were started in the military. Renal dialysis. I mean, just so much. You need to read a little bit about military nursing history. It's a fabulous story. And then it's a family and it's a connection. I felt a connection with Linda the first time I met her. And part of that is because we've both served in the military.
Right.
That's wonderful to hear that. And thank you for answering that. I know our audience appreciates hearing your background and the support that you felt in the military and that you currently feel. I want to ask you one more thing, Dr. Patrician. I understand that you work with the VA and an academic medical center, and I wondered if you could tell us about how that interaction happens and what that looks like.
Well, the VA, in order to get really good physicians back in the 50s, started partnerships with academic medical centers and medical schools. And, a lot of people were wondering, well, why don't nursing have those same relationships? Well, the VA started partnering with, maybe not started, but formalized partnerships with academic institutions, colleges of nursing, probably in the mid-2000s. And we have a VA partnership at the University of Alabama at Birmingham. And there are many around the country. But what I co-direct here at the Birmingham VA is the VA Quality Scholars Postdoctoral Program. This is an interprofessional program to teach and train providers to continually improve the quality of care and services they provide, to conduct research in those methods to improve quality. And we have currently 2 surgeons, 2 pharmacists, and 1 nurse in our program at the Birmingham VA, but this is a national program. And you, as a postdoc, you get a postdoc salary, and you get the opportunity to do a lot of scholarship work with the VA and at the VA. There are, I think, 9 to 10 sites around the country. And so, if anyone out there is interested in this opportunity, you're more than welcome to email me and ask. And you can also Google VA Quality Scholars Program or vaqs.org.
Thank you. We are about ready to wrap up. I wonder if before we go, Dr. Schwartz, you could give us one takeaway.
Well, when I think about the have you ever served, my takeaway from this is that your patients are your very best teachers. That if you listen and look, you and understand, you will be able to learn a great deal that will apply to your practice. So I give my patients a lot of credit for having the patience and the understanding. And sometimes they didn't know they were helping me understand. But that's where the rubber meets the road. All patients are not the same.
Wonderful words of wisdom. Dr. Patrician, what would your takeaway be?
My takeaway is ask the question. Please ask the question, have you ever served? There are a lot of homeless veterans that don't need to be homeless. There's a lot of people suffering that don't need to suffer financial difficulties because of their health that might qualify for veterans health care. So please, everyone out there, ask the question.
Thank you so much. And I want, again, to thank you both for your service and all that you continue to do. And that's it for today's Clinical Pearls. Please join us next time.
If you liked this video, please remember to like and subscribe, and click the bell icon to get instant notifications when we release new videos. Thanks for watching.